Well, osteoporosis literally is thin bones, and the problem with that is that the underlying microarchitecture of the bones deteriorates, and so they're prone to fracture. When you go through the menopause, you lose estrogen, and estrogen has profound effects on the bone, so that the loss of estrogen at the menopause results in an increase in bone breakdown, which leads to bone loss and hence to the development of osteoporosis. So the average person doesn't need to have an assessment of bone density unless they're perceived at any increased risk for getting osteoporosis. And that would be, for example, people with a family history of fractures in relatives, or people who've had steroid treatment for asthma, which we know has an adverse effect on the skeleton. So situations like that, then we would say, yes, it's probably worth getting a check of your bone health. And the way we do it is by a technique called dual energy X-ray absorptiometry, which basically is bone density measurements. The main treatment of osteoporosis is to give drugs that will reduce bone breakdown, so reduce bone resorption. And we have a number of different drugs that are able to do that. We have some newer drugs coming along that will actually help increase bone formation, but they are extremely expensive and have therefore very, very limited availability, and so are still experimental. One of the drugs that will improve bone health is HRT, and we've got plenty of evidence to show that taking HRT actually improves bone health. It reduces the risk of fracture, and it is as effective as any other current treatment that we have. There's really very little one can do to increase or change your bone health because your bone mass is genetically determined, you inherit it. So lifestyle changes, which of course are just good for general health, really have very little effect on bone. Diet and exercise really have a very, very small contribution to make.